Welcome to another episode of the What is Global Health podcast. Today we'll be talking to Dr. James Colgrove, a professor of sociomedical science at the Mailman School of Public Health. His current research focuses on the relationship between individual rights and the collective well-being of the population. Could you please introduce yourself, Dr. Colgrove?
I'm James Colgrove. I'm a professor in the Department of Sociomedical Sciences at the Mailman School of Public Health. I also recently started a position as the Dean of the Postbac Pre-Med program at the Columbia School of General Studies. I had a kind of a circuitous path, career path that brought me to where I am, a non-traditional path. I worked for many years in the field of public health, for about a dozen years, doing community-based public health education in the areas of HIV and adolescent health. I did this work without any advanced degree. I had no formal training in public health, and that's a career path that it's much more difficult to have now because so many more people have MPHs, and the MPH degree is now really an entry-level degree. But I got into this work, and after doing it for a while, realized that I was going to need some additional training and credentialing, and so went back and got an MPH and a PhD in public health in the department that I now teach in, sociomedical sciences at the Mailman School. And did not intend to be an academic. I wanted to work in policy or government, and or perhaps in philanthropy at a place like Robert Wood Johnson or Ford. But when I finished my degree, my department offered me a faculty position, and I took it. And I stayed really because the environment at the Mailman School is really an extraordinary place. The students are incredible. The faculty are doing an amazing work, and it's just a really exciting place to be a part of. Very engaged with the real world of public health policy and practice. You don't feel at all like you're in an ivory tower at the Mailman School. Really, all of the faculty are connected with actual issues in the real world of public health practice, and the students are as well, of course. My research broadly is in the area of public health policy, and in particular looking at historical and ethical dimensions of public policy. I'm part of a team of faculty there called the Center for the History and Ethics of Public Health. We start with contemporary issues in public health, and we ask the question, how can an understanding of the history of this issue inform what we should do today? And how do public health issues involve questions of values, of right and wrong, of what we should do or what we can do? So that's the ethical dimension of that. My research interests have to do with the role of the state, the role of state action, and the relationship between individual choices and actions and the role of the state. I've done quite a bit of work on immunization policy, some work on the role of public health surveillance, some work on tobacco control. Those have been my major areas of research. The work that I've done that has been most compelling for me has been mentoring and advising students and teaching students. And that's partly what led me to my current position, leading the postbac program here at General Studies. So the goal of this program is to provide a pathway to medical school for students who do not have traditional pre-med backgrounds. Students who have not done the required science courses. And it's a really amazing program that is bringing into medicine, I think, the kinds of people with varied life experiences and non-traditional backgrounds that medical schools want, and that the field of medicine really. That was a very long-winded answer. I think that I got an answer to your question in there somewhere.
Oh, yeah, of course. So you worked in the public sector for a while before transitioning into academia. Since making this transition, what are the main differences you found between these two areas of life?
I think the biggest difference is that being in academia gives you the chance to have a broader view landscape of public health. Working in a community organization, it can be very high pressure work. The workload is quite intense, and there's often not an opportunity to see how your work fits in with kind of the broader landscape of public health. When I was working in adolescent health and designing health promotion and health education programs for adolescents, I think I would really have benefited, my coworkers and I would all have benefited from a chance to step out of that work and see how that work fit into a broader context. There was information about health disparities in general, about the broader health profiles of the populations that we were dealing with that really would have helped us better understand the work that we were doing and design better programs. But there simply wasn't time in the day-to-day pressures to get that kind of perspectives. Academics, in a way, have the luxury, I guess you could call it, of seeing a big picture, of being in regular contact with colleagues whose job it is to study and get that big picture. I mean, that's one of the things about being at the Mailman School that's I think so valuable, is the chance to connect regularly with colleagues who are really looking at public health issues in the broadest possible way from many, many different perspectives. The average person in the public health workforce who's on a day-to-day trying to deliver programs and services doesn't have that luxury. And so I think that's the biggest difference in being in an academic environment, is the ability to see that big picture. I think the potential downside of that, which I haven't seen at Mailman, is that academics obviously are less connected to the kind of on-the-ground reality of what it's like to be providing those services day after day. And that's why I think it's very important for faculty members to regularly be in touch with and working with and communicating with people outside the academy, which is very much something that happens at the Mailman School. I just think that exposure to actual on-the-ground work is invaluable. I mean, I couldn't now teach what I teach if I hadn't spent 12 years working in public health in those frontline positions.
You've mentioned a lot of public health is based in the community. In the modern world, what role do you think grassroots movements have in influencing policy? Do you think we as students are doing a good job to live up to the task?
I think in some cases we are. I mean, public health absolutely has an element of community engagement, right? To the extent that public health seeks to partner with communities, grassroots organizing and engagement of affected communities is essential. How well we are doing, I think there is extraordinarily effective work being done across a variety of realms. I think of work done in maternal and reproductive health, on youth health issues, and I think there's a real recognition among public health professionals that engaging communities in a meaningful way is essential. I mean, we teach courses at the Mailman School on community engagement, on advocating for health, on community-based participatory research. So I think there's a recognition in the field that this is really essential.
Right, so regarding these specific topics, I read your 2013 op-ed that called vaping a necessary evil as opposed to traditional smoking. Especially with the New York State ban on flavored nicotine, where do you stand now?
I still think that e-cigarettes and nicotine delivery devices through vaping have a potential for harm reduction. And the events in recent years, I think, to me, demonstrate the need for better, more comprehensive regulation and enforcement of regulation. but I don't. I still think that the potential of these devices remains for the millions of people who are addicted to nicotine and for whom these have the potential to reduce their risk of illnesses that are related to tobacco consumption.
Do you think do you think the ways things are happening right now where these companies are targeting like adolescents, do you think that kind of plays into use of e-cigarettes as like a transitionary? Because a lot of people are using this as like their first step.
Well, that's the fear, and
right.
that has always been, I think, a legitimate concern, and I think that concern can be addressed in a variety of ways, including through effective regulation and education. I mean, the big unknown when these products started to become popular was, will they be a pathway away from tobacco for people who currently use tobacco, cigarettes, combustible or chewable tobacco, or will they be a pathway towards traditional tobacco products as sort of like the classic gateway drug? Will people start on these and then progress to tobacco? And the evidence on this has been kind of mixed. We're still learning. It appears that that it's possible that both of those pathways are happening, that some youth are starting these as their first exposure to nicotine and then are progressing to more harmful combustible tobacco products. On the other hand, there also is evidence that it's working the other way, that people can transition from dangerous tobacco products to less dangerous e-cigarettes. Obviously, the former pathway is the one that we don't want to happen, and I think that can happen, again, through appropriate regulation and enforcement of regulation. And you may have seen in the news recently, the administration has now backed off, I think, what were going to be very good regulations around flavored tobacco products because of commercial pressure. This is sort of a classic example of the marketplace and economic motives acting against public health. So I think, there's a lot of work to do, but I think good, effective regulations and education can help address that.